I've no disclosures to mention. And in 2020, we were overwhelmed with the COVID-19 pandemic. And in the Netherlands, the first surge was between March and July 2020, in which we had around 3,000 ICU admissions. And good to know, we have around 84 ICUs in the Netherlands with around 1,050 operational ICU beds, which were upgraded then to 750 ICU beds at that time. And the second surge was between October 2020 and July 21, where we had in total around 9,450 COVID-19 ICU patients in the ICU. So you need to know that we have around 4,000 ICU nurses in the Netherlands, but during the crisis this was upgraded with former ICU nurses as me, ward nurses, and sometimes even physicians. We, and probably you all, experienced several difficulties as working under thought conditions with personal protection equipment, family restrictions, or even not allowing family visiting the patients. Also very sick patients, frequently prone positioned. So the working conditions were physically and also mentally hard for ICU nurses. And therefore the aim of our study was to measure symptoms of anxiety, depression, post-traumatic stress disorder, and work-related fatigue, and to examine which factors are associated with these symptoms. And the study was performed after the first surge in September 2020, as you can see here in the red line, the first red line. And 1 year later, we repeated this in September 2021, at this time. So this was after the second surge. For the study, we set out a survey with validated questionnaires via our own professional network that we have, and also this was announced in newsletters from Venticare, a Dutch ICU knowledge and congress organization, and the Dutch professional organization for ICU nurses. And besides demographic data as age, gender, work experience, and some additional COVID-related questions, we collected data of the mental status of the ICU nurses by using the hospital anxiety and depression scale, with 7 questions regarding anxiety and also 7 questions for depression, with scores ranging from 0 to 21, and a cutoff value of 8 or higher for symptoms of anxiety and symptoms of depression. We also used the impact of event scale with 6 questions to detect symptoms of post-traumatic stress disorder, and we had the need for recovery after work scale, the NFR, to detect work-related fatigue symptoms. And importantly, data were collected anonymously. In total, we had 726 nurses responded in our first survey, and 723 nurses that responded in the second survey 1 year later. And ICU nurses who responded were experienced nurses, as you can see here, with an average of 70 years experience. And most of them, almost all, had worked in the COVID unit, and 30 to 40% worked in an academical hospital, and over 15 to even 80% worked more hours than the contract was at that moment. And then the mental symptoms results. The participating ICU nurses had a median HATS score of 5 for anxiety and 3 for depression, and a median post-traumatic stress score of around 1, and a need for recovery score of a median 5 to 6. But more relevantly to mention is the overall frequency of mental symptoms for anxiety and depression and post-traumatic stress disorder or the work-related fatigue, which was 52% after the first surge and was significantly higher after the second surge. So in more detail, you can see here the mental symptoms depicted in more detail. Symptoms like anxiety were experienced in 27% after the first surge and 30% after the second surge. For depression, this was 19% after the first surge and 21% after the second surge. And for the post-traumatic stress symptoms, this was 22% and 80% respectively. So somewhat lower after the second surge. But the work-related fatigue increased from 42% to over 50% after the second surge. Working in an academic hospital increased the risk to have symptoms of anxiety, depression or PTSD with 80%, and for work-related fatigue this was even 50%. When being afraid to be infected, to infect the relatives doubled the risk for symptoms like anxiety and depression. And understaffed personnel who also increased this risk almost twice. And nurses that had sufficient time of holiday after the surge decreased the risk significantly for depression with 40% and halved it for work-related fatigue. Importantly, to learn from working during the crisis situation was that what helped nurses was sharing their experiences with their colleagues. That helped 90% of the ICU nurses. And also to share this with family and friends, daily or less frequently debriefing their work and support from professionals at work like a psychologist. That helped the nurses as well. What could have helped nurses, what they said was lowering the working load, and around 45% of the nurses mentioned that. Working in fixed ICU teams was mentioned by 30% of the nurses, and having a say how to catch up with the standard care in 27%. And more flexible schedule was mentioned by 23% of the ICU nurses. And all this information was afterwards shared with the ICU managers in the Netherlands to learn from this and to adjust their policy. So ladies and gentlemen, what we can learn from this, the COVID-19 crisis really impacted the nurses' mental well-being with high numbers of anxiety, depression and PTSD, and around half of the ICU nurses suffered from mental symptoms after the first surge. That increased to almost 60% after the second surge 1 year later. And furthermore, several factors increased the risk for these mental symptoms, but having a sufficient holiday to recharge the battery decreased these symptoms. So many thanks for all ICU nurses that completed one or maybe both of our surveys. Furthermore, I would like to thank the Venticare organization and the Dutch Professional Organization for ICU Nurses for their support, and thank you for your attention. If you have any questions, please send me an email. Thank you very much.